Thank you so much for joining us, and a very good afternoon to my panelists. Now, as we know, COVID-19 made it very clear that an outbreak anywhere can quickly become a global crisis. Today, we're joined by extraordinary leaders, supporters of the Global Fund Against AIDS, Tuberculosis, and Malaria, the world's largest funder of health programs in low and middle income countries. Together, we'll be exploring how investments to defeat HIV, TB, and malaria continue to power global health security, and why this is crucial to protect populations and stability of the global economy. Now, Lady Roslyn, let me start with you. Earlier this year, the Global Fund announced a partnership that had crossed the milestone of saving 70 million lives since 2002. And that's over 120 countries, if I'm not mistaken. So to you, what does impact mean and the communities that are affected?
Thank you. Yes, it's a huge milestone, 70 million lives, which would have been lost. And that's not just a number, it's a child, a mother, a brother, a sister. And the ripple effect of saving those lives means that families have stayed together, communities have been made stronger, economies have grown. So it's a number, but it actually has enormous meaning. And the work we do, while we work in HIV, TB, malaria, at the same time, we're building stronger health systems through the lens of those three diseases. And that's essential for global health security, because diseases don't know borders. Mosquitoes don't know borders. People travel. HIV and TB travels. And the work we're doing in building health systems, we're by far the largest provider of grant funds for health system strengthening in the world, is preparing countries and people for the next pandemic.
Absolutely brilliant. Robbie, you're a co-founder, an entrepreneur, but also the co-founder of Goodbye Malaria, which has done incredible work across different countries, economies, in terms of reducing the infectious disease. I want to get your thoughts on private-public partnerships, and I mean the importance in terms of ensuring global health security and moving us forward in this regard.
Yeah, thank you. Good to be here. I think that public-private partnerships, together with academia, you need universities as well, are absolutely critical. We've been partnering the Global Fund for 10 years. My co-founders, Sherwin, Charles, Kim, Lazarus on Goodbye Malaria, and the team of Goodbye Malaria have done incredible work in terms of impacting, together with the Global Fund, 4.5 million lives we've protected in Mozambique. Started with literally one house that we sprayed, and now we've protected 4.5 million lives. It's just like almost a number that's almost incomprehensible. And we could not have done that with a couple of things. And the first was that we're from Africa. It's an African problem, and we needed a solution from Africa. It's all very well to malaria being sorted from the north, and everyone's always looking from the north to come and help the south, but we really needed to get stuck in. And so we needed a partnership really with government, and we needed a partnership with the Global Fund, because the Global Fund could open those doors for us. Government weren't that easy in the beginning, and Global Fund were incredible partners to help us open that. You cannot do it without a partnership of all the parties coming together. It's absolutely critical. Each one's got to do their own bit. And from a business point of view, you have to look at it from an entrepreneurial perspective. And we've looked at it. Goodbye Malaria is really run like a business. Although it's a social impact, the kind of disciplines that we run that is like a business, because the impact that we've had is really impacting the economy. And as you say, health problems really unlock a whole lot of other benefits in the economy. So you have to have everybody and everyone aligned. And we recently included universities into it, and I say that's a very, very important part, because the data is very data-driven, and that's really been the kind of magic of what we've done. And the Global Fund has helped us unlock that. And we work with 3 different governments, so it's been quite a challenge, but yeah, that's what we do. We try and make a plan. We get shit done, basically, by the way.
Can I take up Robbie's point about partnership? I mean, the Goodbye Malaria partnership with the Global Fund and the Mozambique government is quite special, and the South African government. But that's what the Global Fund is. Fundamentally, it's a partnership. It, at both the governance at the global level and within countries in the way that we implement our grants. So we have donor governments, governments of the countries who receive our grants, and in those countries, civil society, church leaders, people living with disease, academia, very important. And often you'll find within country, the donors are represented as well. So our board is made up of that very broad partnership, but that's also reflected at the country level in the way that we operate. And I really believe it's a partnership model that works. We've demonstrated that it works, and I think other endeavors could well emulate such a partnership. And it's very unique because the donors who give money to the Global Fund have no more power than those who receive it. On the board, there's equal numbers from the donor block and what we call the implementer block. And you have to have a majority, 7 out of 10, on each side for any decision to pass at the board. So it's not donor-driven. Donors have their view, but so do the people who are receiving the money.
No, incredible, incredible. I think, and it's the importance around the partnerships in improving and strengthening healthcare systems. Importantly, saving 70 million lives, 120 countries, and lives saved over 23 years, which is fantastic. Lady Roslyn, one of the things I'm hugely passionate about is I head up healthcare delivery transformation, and for me, innovation is a huge part of the healthcare system. And I want to find out from you, what do you think innovation or the role of innovation and what it plays in us fighting the fight against infectious diseases such as HIV, malaria, and tuberculosis, and sort of the impact that it has in the communities too?
Innovation has been central to the progress that we've made in the last 23 years. If we take, and it's not just innovation in products and science, but also in financing and in the way we implement programs. But if we, a really good example is, for example, using our collective marketing power because of the volume of commodities that we procure each year. We've been able to bring the cost of antiretroviral treatment down from $10,000 from 2002 to just $35 now. And I mean, that's extraordinary. And it's meant that tens of millions of people have had access to treatment that they may not otherwise have done. And we can tell similar stories for TB diagnostics, TB treatment, the cost of malaria nets. Robbie will know that today they're much cheaper than they were when you started 10 years ago.
Insecticide as well. Insecticide has come down.
Too. And there are lots of exciting innovations available for HIV, TB, and malaria at the moment. I'm sure we've all heard about lenacapavir, a long-acting injectable prevention tool for HIV, which has the potential, if we can get the cost down enough, to change the whole trajectory of HIV. And there's also work being done in South Africa. Trials are taking place in South Africa, Kenya, and Uganda, I think, is the third country, for an oral PrEP, a tablet taken just once a month that would be very cheap, estimated around $5 a year, so anybody could afford it. That will also, if it proves efficacious and safe, it will change HIV completely. In TB, we're rolling out the use of AI-powered diagnostic tools, and also using portable X-ray machines. There's a lot of work going on skin tests for TB diagnosis, mouth swab tests, which of course to diagnose children is so much easier than the old-fashioned way. Same in malaria, with the dual-action ingredient nets that help overcome insecticide resistance. And we're trialing spatial repellents for mosquitoes in Mozambique, I think.
Yeah.
So there's lots of exciting new things, and so important that we introduce these tools. It's only by doing that that we will really achieve our aims.
Now, what you just shared is really the power of volume-based purchasing, the power of large language models, the power of AI and causal modeling in order to advance healthcare, and I find that absolutely incredible. Robbie, in the 3 minutes we've got left, I shall give you 2, right? As an entrepreneur and someone who works in the private sector, we know that COVID changed a lot of the dynamics within countries, and economies stopped. In your sense, can you give us a sense, as a person in that space, what countries and the private sector need to be doing together, so public and private sector, in order to ensure global health security and sustainability of our healthcare systems?
Perfect, thank you. I mean, I think it's a model that public-private partnerships have to work together. And if I look at it again, just moving out of Mozambique for 1 second into Josie, we're in Josie at the moment. So Josie My Josie, for example, is a brand that was really created as a brand of trust. Because what you have to develop in a time of, let's say, normality, because there's nothing, it was certainly Joburg, there's no normality. So let's just say, we're not in a time of normality, but it's really a question of building trust for that time, that when a pandemic does hit, that you actually trust with everybody. And we've seen that in Mozambique particularly, and that's why with us partnering the Global Fund, it was essential that we partnered them as a brand of trust, and then they could help us engage with government, because they trusted government, government trusted them, and we have a responsibility as well to deliver. So it's all about deep, deep trust. For me, the opportunities that we have in South Africa today, or in Southern Africa, because it really is a Southern African opportunity, because there's a lot of work to be done. I mean, there's a lot of work you can almost throw a pebble anywhere, and there's work to be done everywhere. And the opportunity now to make a difference, for private companies to make a difference, is absolutely incredible. You have to be innovative. You have to be building trusted brands, or using your trusted brand to move forward. You have to then be doing things in a way that has impact. You can't just talk. You have to talk, you have to do, and then talk. It's not just a question of doing, and you're doing it because you want the brand out there and a ribbon cutting and all that kind of bullshit. You want to be able to go and do stuff, and then once you've done it, say, this is what we've done. And there's no better place to be doing it from in Josie, in South Africa right now, and in Southern Africa. So to me, what you were talking about in that kind of relationship but it's really building trust. And with trust comes responsibility, massive responsibility, because you have to behave. Everybody has to behave with certain responsibilities. You have to be doing, but it really is in how you have to have human dignity at the core. That's why as South Africans, our constitution is one of the best constitutions in the world. It talks about human dignity, how we treat people in Mozambique. We started with Goodbye Malaria, with human dignity at the core of everything that we did. And as South Africans, we have a responsibility to pull that out to our neighbors as well. Huge responsibility. So for me, it's a perfect time to be doing trust building at a time when you don't need it. And then when the shit hits the fan, so to speak, that trust plays into it. And when a pandemic comes, we'll be ready for it, because it's going to come. So, and if it's not a pandemic, something will come. We live in Joburg anyway, so something's going to happen. But we'll be ready when it does come.
Yeah, no, thank you so much, and thank you to our panelists. And I mean, with that being said, really, there's still a lot of work for us to do in terms of ensuring that our health systems are sustainable and continue to be dependable in order for us to prevent any future pandemics. And with that being said, later on, I believe there's an announcement taking place around the 8th replenishment for the Global Fund, and looking forward to that. Once again, thank you and have a very good afternoon.